Sarah's heart pounded as she lay face down in the sterile MRI machine, her arms stretched painfully above her head. The cold metal surface pressed against her skin while the machine's mechanical whirring filled her ears. She had mentally prepared for this guided biopsy procedure, knowing it would be uncomfortable, but nothing could have prepared her for what happened next. The room suddenly erupted in chaos. One of her healthcare professionals had entered to assist with the procedure, but within seconds, blood-curdling screams echoed through the medical facility. The nurse had spotted Sarah's large tarantula tattoo sprawling across her arm, a piece of body art that was admittedly oversized, but so unrealistic it looked more like a cartoon than an actual spider. The healthcare worker's arachnophobia had triggered an intense panic response, sending her fleeing from the room in terror. Sarah remained trapped in the machine, bewildered and increasingly anxious as precious minutes ticked by. The delay stretched on, adding to her mounting stress and physical discomfort. But the spider tattoo incident was only the beginning of Sarah's ordeal. An unrelated technical complication caused a second delay, extending her time in the claustrophobic machine to nearly 90 excruciating minutes. Her shoulders burned as circulation was cut off to both arms, which remained pinned above her head in an increasingly painful position. When the biopsy was finally complete, Sarah faced another challenge. She needed to carefully turn over so the medical team could dress her fresh incision site. One nurse pressed firmly against the wound to control bleeding, while the arachnophobia-stricken colleague was instructed twice to help Sarah rotate her body. The frightened nurse remained frozen, unable to assist. Sarah struggled to turn herself halfway, muscles screaming in protest, while the first nurse's hand could no longer maintain pressure on the bleeding wound. "Grab it, grab it!" The attending nurse called out 3 desperate times, trying to get her colleague to take over wound care so Sarah could complete the turn. Sarah hung suspended in that agonizing half-turned position, feeling warm blood seeping from her incision while waiting for the phobic nurse to overcome her fear and provide essential medical care. The seconds felt like hours as she remained trapped between positions, vulnerable and bleeding. Throughout the entire dressing procedure that followed, the arachnophobia nurse retreated to a corner of the room, offering no assistance while her colleague worked alone to tend to Sarah's wound. Sarah wondered if this abandonment of duties was standard protocol or if her tattoo had essentially rendered one of her caregivers useless. Despite her frustration and the compromised care she received, Sarah chose grace over confrontation that day. She thanked both nurses politely and left the facility without voicing her concerns, though the experience left her questioning the professionalism she had encountered. Days later, a patient satisfaction survey arrived in her email inbox. Sarah stared at the screen, knowing her response could impact these healthcare workers' evaluations and potentially their careers. She understood the weight that customer reviews carried, having worked in service industries herself where surveys determined success or failure. The internal conflict was real. Should she show understanding for a medical professional struggling with a genuine phobia, or should she honestly report how that phobia had compromised her medical care and safety? What would you do in Sarah's situation? Was her care truly compromised, or should healthcare workers with severe phobias receive more understanding? Share your thoughts and feelings about this complex situation in the comments below.